Good afternoon. It's nice to have you join us on Panorama. I'm Joseph Johnson. On Panorama today, federal government grants pardon to inmates in continuation of the decongestion of custodial centers. No mask, no movement begins in Calabar. And special advisor to the president on social investment program reacts to public claims of the program. Thanks for joining us on the program. Convicts have so far been granted a pardon by the President. The Ministry of Interior has flagged off the presidential pardon of inmates in continuation of the congestion of the custodial centers by the Minister of Interior, with Minister of Justice and Attorney General of the Federation and Minister of Information present. Our reports indicate that so far there is no case of COVID-19 in any of the custodial centers. 39 inmates have been granted pardon by President Buhari across the nation. Now, NTS Victor Azu joins us live from Kuje. Victor, give us a brief on how benefiting inmates qualified for pardon in terms of status.
Right, thank you, Joseph. Now, what was considered, for instance, old age was one of the major factors considered in granting the presidential amnesty to inmates. If you are 60 and above, then they want to consider because you don't have really much of your life to spare. And then they consider those who are currently sick. They considered ill health. They considered minor offenses. And awaiting trial inmates, say upwards of 10 years, were also considered.
Okay, so is there any consideration for inmates awaiting trial who have stayed in the correctional centers for a prolonged period?
Absolutely. Just like I said a while earlier, those awaiting trial, say those who have been on that list for, say, 10 years and above, are being considered seriously. And out of all of them, including those awaiting trial, those on minor offenses, those who are suffering ill health, those who are old, aged 60 and above, 39 of them have been granted presidential amnesty by President Muhammadu Buhari. 2 of them granted pardon, 29 released by the FCT administration. And so in all today, we expect that about 70 inmates will be released. And when all the processes are completed, I repeat, when all the processes are completed across the country involving the various state governments, there will be 2,600 inmates who will breathe the air of freedom.
Okay, that's interesting. But we just getting this news. It's more like a break-in. So can you tell us what's the mood like where you are?
Well, the mood is bubbly. The Kuje Custodial Center is looking a lot of persons. It's a World Press Conference that preceded coming to Kuje. And so you have a lot of media people. The Minister of Justice and Attorney General of the Federation has just come in a few minutes ago with the Minister of Information and, of course, the Chief Host, Minister of Interior, the Permanent Secretary of the Ministry, and then the Chairman of the Presidential Committee on Correctional Service Reforms and Decongestion, who is also the Chief Judge of the FCT, Justice Ishak Bello. They have gone into the walls, I'm sure, to conclude arrangements for those who will be released here and now. 4 of them are here in Kuje, and they have gone in. We expect them a few minutes from now so that the formal release will be done and the processes for this place will be concluded to tee off, to signal others across the country to begin theirs.
All right, thank you very much indeed, Victor Azu, reporting live for us there from Kuje. Let's talk more about COVID-19 now, because 22 new cases of COVID-19 have been reported in Nigeria, bringing the total number of confirmed cases to 276. Of the 22 new cases, 15 are in Lagos, 4 in the FCT, 2 in Bauchi and 1 in Edo State. 44 patients out of the total number have been discharged and 6 deaths recorded. Nigeria is now having fewer cases of COVID-19 from returning travelers, but beginning to experience community transmission of the disease in the country. This was one of the highlights of the daily briefing by the Presidential Task Force in Abuja. Mitaire Ikben reports.
As expected,
the Presidential Task Force resumed its daily briefing in Abuja after a day of operations in Lagos, the epicenter of coronavirus pandemic in Nigeria. The chairman, Boss Mustapha, believes synergy among the federal and state governments has to step up as more cases are recorded.
Not to make pronouncements or take decisions that would undermine public safety in this regard.
The task force advises public and private health institutions in the country to brace up for more cases of coronavirus.
Please look out for patients presenting with unusual respiratory tract infections, especially severe respiratory tract infections that cannot be explained, because this is an important indicator now for testing for coronavirus infection.
We have 9 laboratories for testing as at today.
We have trained a total of 270 healthcare workers in each state on case management. These trainings have built capacity among our healthcare workers, not only for this outbreak, which is absolutely critically needed, but also for the future.
There were updates on returning Nigerians.
We've now started to get greater numbers of Nigerians, especially in the United States, where almost 200 have now indicated willingness to return. We're engaging with our embassies in China and our High Commission in London and also in France.
And then a clarification.
No member of the committee receives a penny as sitting allowance. Everybody sacrifices his time, his energy, and even sometimes his resources.
Judging from cases and reports received the world over and in Nigeria, the coronavirus is no respecter of persons or status, tribe or creed. The Presidential Task Force believes that the more Nigerians abide by the restriction and precautionary measures, the better for the health and wealth of the nation. In Abuja, Mitaire Ikben, NTA News.
Still on the subject on Nigeria's integrated national response plan on COVID-19, Ajuri Ngalale joins me now in the studio. He is the Senior Special Assistant to the President on Public Affairs. Good to have you, Ajuri.
It's good to be here. Thank you.
All right, so let's talk about the presence of the 15 Chinese medical doctors in Nigeria, and of course the seeming initial opposition by the NMA, that's the Nigerian Medical Association, and other groups. So I'm not sure that has changed for now. So if you can put in perspective, what is the rationale for their presence in Nigeria?
Thank you very much. I think the initial opposition we had heard was based on a misunderstanding of what it was that the medical professionals from China were here to do. Clearly, Nigerian law is very clear as it relates to those who are authorized to practice medicine in the country, who are authorized to, for example, deal with our patients in terms of patient care. And that is not going to be at all infringed upon with the presence of these medical professionals from China. We've made it very clear that these individuals are virologists, individuals who understand the complexities involved with an outbreak of a virus, and clearly with their experience in Wuhan, they have shown that amongst all the countries in the global community, that they have shown that they have been able to kind of stem the tide. So just to share their expertise with our professionals, so that our professionals are just that much more equipped to deal with some of the issues around the outbreak. But in terms of, the idea that there's some sort of threat in terms of impinging on the ability of our practitioners to practice medicine, that simply just does not exist.
Indeed, because that's been going around, the town for...
Right, and it's just false. Yeah.
Okay, all right. So thanks for clarifying that for us. We have a few other questions from our viewer, Magdalene. Let's get that question now.
Omar from Cross River State. My first question, what palliative measures is the federal government giving to SMEs whose incomes and those of their staff is adversely affected by the sudden lockdown?
Yeah, sorry. I'm not sure you heard the question clearly. Okay.
She referenced, micro, small, and medium scale enterprises. To what extent will they be, assisted during the lockdown? It's a very important question. We're very concerned about our business people as well as the most vulnerable segments of our population, which is why we have put in place a variety of measures to assist them. Namely, the CBN has already announced a 1.1 trillion naira intervention fund. That's in the billions of dollars. That is going to be targeting the manufacturing, agribusiness, oil and gas, tourism, and other related sectors that have been hard hit by COVID-19 to be able to access liquidity and financing to sustain their operations. So those facilities are out there just for them. Then in addition to that, within that, you have 50 billion naira that's been set aside, particularly for households and micro and small, medium-scale enterprises running through the Nursal Microfinance Bank. That is a very simple process. Across the country, Nigerians can apply, submit their application, and have access potentially to those resources to make sure that their businesses are funded during this period of downtime economically. And I also want to reference the fact that the President just over a week ago constituted the Economic Sustainability Committee chaired by Vice President Professor Yemi Oshibajo, and that is going to have a profound impact, the work of that committee, on the ability of micro, small, and medium-scale enterprises to function moving forward through this time, because we're working closely with the National Assembly to see how we can make some legislative interventions to incentivize financially the process of encouraging employee retention, so that perhaps we can give potentially tax credits to businesses across the country in exchange for them retaining employees through this very difficult time. So there are a series of measures that we're putting in place to protect our business people and our working staff across the country.
Talking about working staff across the country, there's this other issue about overzealous enforcement of the restrictions in place in some states. You probably are aware of what happened in Calabar, Cross River State, and a few other places. And I heard some of my colleagues even recounting how they were harassed and delayed unnecessarily on their way to work, which also impacted negatively on what they were supposed to do, despite the President's directive on who and who should be exempted. So tell me, were these police officers not properly briefed by the government?
I doubt that it's an issue of not being properly briefed. I am familiar with what you're referring to. It has been a reality in some places over the last few days, but I think it's very important for us not to allow the overzealousness or relative insubordination of certain few officers in parts of the country to overwhelm the work that over 95% of our police officers have done across the country. They've done very well. Our people have also done well in terms of abiding by the directives. I think it's very also important to mention that the IG has already come out after initial reports came out about what you're referring to. He's already come out to direct all of his men to ensure that they maintain the standards expected of them in the process of making sure that they enforce the directives of Mr. President. And I think since then we have seen certainly a toning down of some of the challenges that you mentioned.
Well, we hope that it's really going to reflect from what you're saying, because if we get a different narrative, it contradicts your.
Well, I think it's important to note that if you have, for example, 1,000 officers out there and one officer makes a foolish mistake, that officer is held accountable. But by no means should that one officer's mistake begin to smear 999 other officers who are doing a fantastic job.
Indeed, indeed. Thank you, Jury Ngalali, for coming on Panorama. It was interesting speaking with you. All right, I've been speaking with Jury Ngalali. He is the Senior Special Assistant to the President on Public Affairs. You're still watching Panorama with me, Joseph Johnson. Let's take you now to Calabar, Cross River State, where the no mask, no movement order with more than 50 patrol vehicles to conduct surveillance and enforcement in all the 18 local government areas of Cross River State has commenced. Paul Abel reports that Governor Ben Ayade, who flagged off the campaign, is part of measures to keep COVID-19 away from the state.
No mask, no movement. No mask, no movement.
The Cross River Garment Factory is saddled with the responsibility of providing nose masks at no cost to residents as they comply with the stay-at-home directive. In order to contain the spread of the virus while going about some essential services, the government says no mask, no movement, which took effect in the state from the 6th of April 2020. This directive places Cross River State as the first in the country to embark on this idea of no mask, no movement, but there are several questions begging for answers. What is the possibility of distributing masks to all residents? Where can the people obtain the masks at no cost? NTA News went around town to check the compliance level and enforcement of the order.
When government give order, you must go to follow them, do the thing, continue.
It's okay. If I can even pick one, yeah.
Some of them make provision for their own mass.
The state has no movement restriction based on the government's sensitivity to the economic needs of the people, but necessary precautions are taken to prevent the entry or spread of the virus.
The state has a very lengthy border with the Cameroons. So, and each of these local governments, you have some illegal routes which have to be manned. So in addition to neighboring states, you will see that if we really have to lock our borders perfectly, then we need to man and police every single entry point into Cross River State. And so what we have flagged off today is a massive campaign of no mask, no movement.
Behind you, Your Excellency, are over 50 vehicles which you have provided for this response. This is the first in Nigeria.
As the government continues with the daily production of thousands of nose masks for the public, violators in vehicles will have their vehicles impounded for a fine of 300,000 naira, and erring individuals will be quarantined for 14 days in their homes.
In Calabar, Paul Abel, NTA News.
67 Nigerians arrived Nigeria Wednesday through the semi-border post. A statement by the Nigeria Immigration Service Public Relations Officer, DCI Sunday James, indicates that contrary to an early report, the returnees were received by NIS operatives who handed them over to officials of the Lagos state government after thorough profiling of the 67. 58 are from Osun State, 4 from Lagos, 2 from Oyo, and 1 each from Ondo, Edo, and Ogun states. The special advisor to the president on social investments, Mariam Uwais, said the attack on the operation of the social investment program is not justified in view of the successes recorded on the program. In a response to the selection of beneficiaries, Mariam Uwais said her role and singular focus has simply been to comply with the terms of agreement and the MOU entered into by the federal government of Nigeria, as well as establish an objective of an efficient and transparent process for uplifting the poor out of poverty through structures and mechanisms that are credible and sustainable. Mariam Uwais described as untrue and regrettable claims that information about the NSIPs was not accessible to the National Assembly, stressing that all invitations to public hearings and meetings were honored and documents relating to the structure, activities and progress of the NSIPs were routinely shared with the National Assembly over the period that the program was under the auspices of the Office of the Vice President. She described also as misleading the allegations that the program gulfed over 2 trillion naira since 2016 when the fund was created, as well as all releases for the programs between. The conditional cash transfer of the federal government today has gone beyond just providing succor to the poor and vulnerable persons in the country. For Asukwa Andem, one of the beneficiaries in Odukmai local government area of Cross River State, the money has literally resuscitated his ailing mother at this time of lockdown. Mobasidet has the report.
The government do something is good because like my mom see, she not well, so for now government help my mom see to wake up now. My mom see feel normal.
Asukwa Andem is one of the 11,995 beneficiaries of the conditional cash transfer in Cross River State. Others too have this to say.
Federal government, thank you. And God bless in Jesus' name.
This money will help me to do any other thing, my family, my business, my children in school.
In Cross River State, 235,900,000 naira is to be paid to beneficiaries across the 18 local government areas of the state.
And there's what is called the top-up. Top-up is paid as extra to the vulnerable groups. So for this particular set of people, as against 20,000 naira that is paid to the other vulnerable groups and poor families, these people are receiving 40,000 naira as we speak.
The payments made to the poor and vulnerable households would also cushion the effect of the COVID-19 lockdown. In Odukmai local government area of Cross River State, Umo Basidate, NT News.
Let's talk sports now. Tokyo 2020 athletics qualifications suspended until December.